Hi, I'm Dr. Jomaa. Welcome back to my channel. This is the second video in our series on osteoarthritis. Today, we're going to explore in a bit more depth how the diagnosis of osteoarthritis is made. We will review the elements of history, examination findings, as well as the role of imaging such as X-ray and MRI in helping diagnose the condition. As always, please remember that this is informational and general educational advice. If you have any medical problems, please go and see your own sports physician. So on your first presentation to see a specialist, your sports physician's going to want to take a comprehensive history about you and your osteoarthritis experience so far. The two cardinal signs that patients describe are joint pain and stiffness. Pain is often generalized in nature. It's deep and aching. It's usually worse with activity and relieved by rest. But in more advanced cases, patients can have pain at rest too. We're going to dive a lot deeper into the pain experience of osteoarthritis in my next video. Stiffness in osteoarthritis is usually short-lived, lasting around 30 minutes in the morning. Patients can also experience a period of stiffness after inactivity, and this is called gelling. By the time a patient comes to see a specialist, they may have a whole host of other features. This includes, but is not limited to, reduced function, mechanical symptoms such as clicking, catching, locking, or a sense of instability in a joint, and commonly also they report crepitus, the feeling of scraping or grinding throughout range of motion. Beyond purely clinical parameters, a sports physician will also ask about how pain and other symptoms have affected quality of life. Understanding how a condition affects day-to-day living is crucial to a holistic approach. A sports physician will typically ask about your functional limitations, coping mechanisms, and your psychological well-being. Paying attention to psychological distress is as important as addressing physical symptoms. So let's now talk about the physical examination. When assessing osteoarthritis, a comprehensive physical examination is essential. This would include assessing body composition, such as height, weight, and waist circumference. A sports and exercise physician will assess a joint's tenderness, range of motion, ligament stability, and perform postural alignment testing and functional tests. Typical findings in osteoarthritis include reduced joint range of motion, joint line tenderness, and potentially an effusion in the joint. There may be crepitus throughout range of motion. In late stages, there's also often an observable and palpable bony enlargement. These are commonly seen in the hands and are known as Heberden's nodes and Bouchard's nodes. The diagnosis of osteoarthritis was historically based on radiographic findings. The key X-ray changes we would look for include joint space narrowing, subchondral cysts and sclerosis, and the formation of osteophytes. The role of imaging in diagnosis, however, is coming under much scrutiny recently. This is particularly because of a lack of correlation between imaging findings and patient symptoms. In the early stages of osteoarthritis, X-rays have a very limited utility in assisting diagnosis. To help illustrate this point, consider this. Approximately 25% of patients aged 55 or older will report knee pain consistent with osteoarthritis in any given year. However, only half of these patients will have X-ray changes consistent with osteoarthritis. On the other hand, the finding of osteoarthritic changes on X-ray is often an incidental finding. This means it's discovered even though it's not the cause of the patient's symptoms. Even in patients with knee pain and osteoarthritic changes, there isn't a guarantee that the osteoarthritic changes themselves are what's causing the symptoms. And we'll talk about this more in my next video on osteoarthritis pain. To assist doctors in making the diagnosis of osteoarthritis, there are specific diagnostic tools which can be used. This includes the diagnostic criteria set aside by the American College of Rheumatology. This serves as a guideline for a holistic approach to making the diagnosis. Blood work and lab findings do not play a significant role in the diagnosis of osteoarthritis. They can, however, be ordered to rule out other similar conditions. With this said, some studies have identified higher inflammatory markers, such as interleukin-6, and CRP in patients with symptomatic osteoarthritis compared to control groups. However, this is not a consistent finding and is not part of the diagnostic criteria. Ultimately, in order to make a diagnosis of osteoarthritis, it's essential to rely upon a good history, a physical examination, and imaging findings. Thank you for joining me on this series in understanding osteoarthritis. In today's video, we reviewed the typical presentation of the condition and what factors we would consider in making the diagnosis. There's plenty more to come on osteoarthritis. Next time, we'll begin exploring the relationship between osteoarthritis and pain, and what the causes of pain are. The findings may surprise you. If you're enjoying this content, then please give it a like and consider subscribing. Until then, stay healthy and stay active.